afternoon, everyone. Myself, Dr. Shweta Sonwalkar, Clinical Head and Fertility Specialist at Oasis Fertility, Belagavi. Today, I will be dealing with sperm DNA fragmentation and male infertility. So, male reproductive dysfunction, it is the sole or contributory cause in half of the couples presenting for treatment of infertility. Coming back to the sperm, there are few unique characteristics of human spermatozoa. Like adult sperm cell, it do not grow or divide unlike other somatic cells. And sperm head has a large nucleus and lacks large cytoplasm. Despite looking normal, sperms may still be damaged. So, coming back to basics of sperm DNA, sperm head nuclear protein. It consists of histone. It is replaced by protamine, producing a tightly compacted nucleus. Protamine is a stronger DNA compared to histone. Unlike all other somatic cells of the body, where histone is the DNA in the nucleus, spermatozoa is the only cell which contains protamine to offer compactness of the sperm head nuclear DNA. Chromatin condensation during spermatogenesis result in DNA occupying nearly 70% of the total volume of sperm nucleus, whereas in somatic cell it occupies only 5% of the cell. So repair capabilities during spermatogenesis phase is limited. The adverse effects of displacement of histone and replacement by protamine may result in haploid genome damage, leading to germ cell arrest or blockage, thereby causing infertility. Therefore, health of the sperm plays an extensive role that extends beyond early stages of fertilization to include abnormal embryogenesis leading to implantation failure and aneuploidy. So, most common causes of poor sperm health is DNA fragmentation, and DNA fragmentation can be single strand DNA break, double strand DNA break, base deletion or modification, inter or intra-strand cross linkage. So, what is this DNA fragmentation means? The physical structure of the DNA strands within the sperm is damaged. This makes it very difficult for the sperm to successfully fertilize an egg. And causes for sperm DNA fragmentation are many, like age of the male. As advanced age of the male, there is increase in the DNA fragmentation in the sperm. Infection of the male reproductive organs, and the person, if he is suffering from cancer, and if he is taking treatment for the cancer, that time also sperm DNA fragmentation increases. If the person is exposed to pollutions or toxins or any radiation therapy, then high intake of caffeine, high intake of alcohol consumption, then if he is suffering from varicocele, then increased testicular temperature, like taking hot baths or sauna bath, and if he is stressful, if he is in stressful condition, and if he is a smoker, then if he is using any recreational drugs and medications, and increased BMI, that is obesity, and poor diet, and infrequent ejaculation, all these causes sperm DNA damage. What causes sperm DNA damage? That is mainly in normal sperm. If the sperm has a normal function, then it means that reactive oxygen species and antioxidants in the sperm, it is maintaining the sperm function. The sperm function means sperm capacitation, acrosome reactions, hyperactivation, sperm oocyte interactions. If this reactive oxygen species and antioxidant levels are imbalanced, that is in case of the causes which I have mentioned, they all causes oxidative stress and leading to reduction of sperm quality, motility, morphology, and sperm count. integrity, leading to decreased pregnancy rates. So this all DNA fragmentation, increased DNA fragmentation effect on reproductive outcome uh, has an adverse impact on male infertility and reproductive outcome. It was reported that men with higher SDF levels were less to conceive naturally and significantly increases the risk of recurrent pregnancy loss. And SDF levels can affect the outcome of assisted reproductive technologies, ARTs, like IVF cases and IUI cases. Result, high SDF values have been found to negatively impact the pregnancy and delivery rates after IUI, and it is associated with lower pregnancy rates and increased miscarriage rates in IVF and ICSI. So, what is the DFI test? It is an effective method for measuring the percentage of sperms with fragmented DNA in the ejaculate. So, what is the significance of this sperm DNA fragmentation test? Sperm DNA damage, it is a useful biomarker for male infertility diagnosis and also for the prediction of ART outcomes. As I mentioned, sperm DNA fragmentation, it is most of the time associated with reduced fertilization rates, poor embryo quality, poor pregnancy rates, higher rates of spontaneous miscarriages, and higher incidence of childhood diseases. Then, who are the couples who are going to benefit from sperm DNA assay? Couples with unexplained infertility, couples with history of unsuccessful ART in the past, couples with history of repeated miscarriages, men at higher risk of oxidative stress, like diabetic patient, drug abuse patient, and who have been treated for the cancer. Those are all benefited from DNA fragmentation assay test. And there are different methods available to assess the sperm DNA fragmentation. They are like direct tests, which, for example, Tunnel and ISFT tests, and indirect tests like sperm chromatin structure assay, known as SCSA, and sperm chromatin dispersion assay, which is more sensitive and with 70% accuracy, and chromatin compaction, example aniline blue and toluidine blue tests. DNA fragmentation index, most studies define an upper normal level of the percentage of cells with DNA fragmentation. Samples with assay results above this threshold percentage are considered to have higher DNA fragmentation. So, to interpret the values, when the percentage of DNA fragmentation is less than 15%, it indicates that person is having good fertility potential. Between 15 to 25% average fertility potential, and spermatozoa with fragmented DNA more than 25% has poor fertility potential. Then how do we manage this sperm DNA fragmentation? It mainly requires lifestyle modification like cessation of smoking and alcohol intake, weight management for obese men, then use of antioxidants. They should be used at least 2 to 3 months for effective outcome. Uh, they are all empirical use for like vitamin C, vitamin E, folic acid, zinc, selenium, and if any underlying pathologies are present, then we have to treat the pathologies like varicocele. Then avoidance of environmental exposure to toxin and judicial medical use of radiations, reducing the abstinence period or serial ejaculation every 24 hours reduces the SDF by up to 25%. And in cases with uncorrected DNA fragmentation, we have to consider surgical sperm retrieval. And even good fertility diet is very important, like high food which is high in vegetables, fruits, nuts, and seeds. Then fish intake is important, particularly which has omega 3 rich fishes. Then more pulses and plant-based foods is very helpful, and patient has to reduce the red meat. Then treatment of abnormal sperm DNA fragmentation. ICSI remains the gold standard embryology procedure to tackle the male infertility. But treatment success, it lies in selection of normal efficient sperm prior to ART, during semen preparation, and during ICSI. And with failed ICSI, newer modalities of sperm selections like TISA or IMSI, PIXI, MAX, or microfluidics will benefit the treatment. And current target of research is to further improve the outcome of treatment, is to find techniques which will identify the sperms with best fertilization potential. Thank you. My wife has undergone second IUI today. She is 32 days. She has small spotting yesterday and today. What it means? Uh, any spotting, she has to consult her consultant, and she has to check for it. First film examination and ultrasound, to know what are the causes for her spotting, maybe any deficiency in the hormonal levels, or any pathology in the cervix also. So she has to consult the consultant. Should I consider using donor sperm if my sperm DNA fragmentation is high? Even with high DNA fragmentation, patient can have his own biological child. She has to Person has to change his lifestyle modification at least for 3 months. If suppose DNA fragmentation is repeatedly high, and he has to consider any pathologies like varicose. He has a varicose, which is causing DNA fragmentation. He has to undergo the surgery, but still prefer his own sperms for the uh, to have a baby. Directly, I don't consider donor sperm. Thank you.